TV. But we would want to go to the central region, Gomuatakwa.
Yeah, so we're heading to Gomuatakwa. So basically, childbirth is actually supposed to be a very exciting thing. It's supposed to be a thing of joy. But some women in Gomuatakwa cannot say the same. They cannot share the same joy that a lot of mothers are experiencing just because of their inability to cater for their medical bills. And this has resulted to the hospitals actually detaining them. We have a report on this by our central region our central regional correspondent right here at ChannelOne TV, Akwesi Ado. Let's watch this report, and when we come back, we will be delving right into it.
Here at the labor ward of the Trauma and Specialist Hospital in Winneba, Philippa Asante has remained in detention several weeks after delivering her baby because she is yet to settle her entire medical bills, which have swelled beyond her ability as a result of a liver disease which is also being treated.
Me buy 2 weeks ni me de pregnancy with liver problem na me de buy adofo na ye me mwa kakra and I mean, I brought it to Mamma Dissino. So I no pay Mrs. Odamachina Tokuku, 3 CD, Mamma, and Madu. When they started hospital near catch and say, my liver problem. And my oborences and me question that me yaman so. I large, I fought one, Tianonama, me swatia, me funa sound.
Veronica Arthur, a resident of Gomuenyami, also remained on admission here at the Gomuogwa clinic for several weeks after giving birth. Being an epileptic patient without support from family makes her even more vulnerable. In most circumstances, the medications for her child are funded by some benevolent health workers.
My family said that, go. You don't have money to help you. So every day I say, God, you are the owner personality. If you can't help me, so kill them, die. I'm tired. Anything to say, can give me anything. I can take it.
Health workers, especially in rural communities in the central region, say they are constantly faced with these situations. Inevitably, they either personally support such patients or mobilize donations from benevolent personalities and organizations to offset the bills.
So for clients who want that and they can't get transportation to go, if there's a mutual fund or something little, so in cases where we realize that this person really needs the assistance to be able to activate the card, we can give the person a token to go and do the activation.
They find it very difficult to take care of their kids because financially they are not really capable, and then due to that they can't afford a whole lot of good meals and even drugs that can help them to boost their HB levels. They can't afford it, and when they are coming to give birth, because of this, it leads to postpartum hemorrhage because they are anemic.
To ameliorate the plight of these vulnerable mothers, some benevolent organizations who paid a visit to random facilities helped to offset some bills, an act done occasionally. But stakeholders believe a deliberate move by government, such as expanding the free maternal health policy, can wholly address the challenge and make childbirth even more dignifying.
I don't know if it's much effective. I don't think they would still complain about the burden on the bill payment side. The mothers are still complaining that they find it difficult to settle their bills after delivery.
Government is doing its best. So we all are stakeholders, like you see the NGOs like the Jabi Foundation, South Sea Network, we are all to help make sure that these policies are fulfilled.
I suggest that there could be a review of the whole policy comprehensively to take care of certain basic needs of vulnerable mothers.
You have that's a report from our central regional correspondent at ChannelOne here, and Akwesi Ado. I mean, this issue of, I don't know.
Not able to take care of your bills? So what if you do not get benevolent individuals or you do not get an NGO, then you are stuck?
You're stuck. Because, you know, like, childbirth is supposed to be a thing of joy. And at the end of the day, this also strikes as, you know, a thing of human dignity too. Yes. Because you're supposed to be excited and enjoying yourself, but right now you are actually stuck. And let's not forget, it's not the hospital's fault, because hospitals actually need the money to run their operations.
I'm just concerned about the lady who wasn't able to clear her hospital bills, and that she's pregnant, and the fact that she has
A
liver
issue too.
that's a huge one. But
Yeah.
Akwesi Ado is joining us via Zoom for us to have more conversations on this. Akwesi, good morning.
Morning.
Akwesi, I trust you are doing well.
Hi.
Very well. Hope you're too.
I'm doing good. This hospital or this health facility you visited in Gomwa Takwa, paint us a picture of first how the facility looks like and how many pregnant women or mothers are there that they've not been able to pay their hospital bills. For that reason, they are still at the facility.
Philip, so we visited quite a number of facilities. The first one was the Trauma and Specialist Hospital in Winneba. And there were quite a number of pregnant women at that facility who were struggling to pay their bills. But we singled out Philippa Asante because she had a rare case or a real situation. Being pregnant and then also battling a liver disease. I mean, it's something huge. And though at the time we visited, she had delivered her baby for several weeks, she was still stuck at the hospital because she wasn't able to pay or offset the entire bills covering one, the delivery of the baby, and then two, the bills for the treatment of the liver disease, which according to the medical officers would even require yet another step of treatment at a more advanced facility. And then we also paid a visit to the Gomua Clinic. The Gomua Clinic is quite befitting, but still they lack some basic essentials. Then we visited the Gomua Takwa Chips compound, and that Chips compound, I mean, it's a mess. The conditions around the building itself and everything, talk of personnel, they are also inadequate. And even beds and even wards for pregnant women, maternal wards for that matter, is something that that particular facility needs it urgently. Then we also visited the Gomwe Shiem Chips compound. They have a very nice building, but they also lack the requisites, tools to help their work. So even while we were there, I remember the lights went off, and then I asked the in charge that how do they cope in such situations? Say someone is in labor and is there to deliver her baby, and the lights go off. What do they do? And they told me they mostly rely on their phones as a source of light, and they actually begged us to get for them some lights. So the next day when we were visiting, the team here in the central region bought an advanced rechargeable flashlight which can last for over 6 hours for them, and also presented some hand gloves for them, just so it can be of some short-term help. So if you ask me about the conditions, even the conditions of the delivery wards, apart from the trauma hospital, the rest, they are nothing good. They are nothing good to speak of, and they really need timely intervention.
All right. So talking about intervention, what are the families and relatives of these women that have been detained doing? Have you spoken to any of them?
Exactly. The family members, if they are equally well-to-do, may have stepped in to offer support, but they are also not in the position to render support, because in the case of Philippa Asante, when we played the full interview, she told us that she was being catered for by her husband, and her husband's job is menial, and it means the husband himself is also struggling. So the husband has tried to offset some of the bills, but they cannot raise the actual figure for the entire treatment. Then the lady we spoke to at the Gomwoga Clinic, she is epileptic, and it looks like she's been disowned by her own family. Nobody takes care of her, and so even when she delivered, it had to take the medical staff at the Gomwoga Clinic to solicit for funds and also contribute to buy some basic necessities. Look, we do know that Ghana is running the free maternal health policy.
Yeah.
But we also do know that when women are in labor and they are going to the labor ward, they have to carry some other items like sanitary towels, buckets, soap, blankets, and all that. Some of these women go to the facilities with none of these, things that are needed to facilitate, their childbearing. And sometimes, if you do not meet uh, a midwife who, is passionate with her job and also practice humanity in everything they do, it's kind of a humiliating situation that mostly arises at the labor wards.
Right.
I was about asking you that the free maternal health care, and if you say that these mothers or the pregnant women owe for that reason they are not able to defray their cost or clear the cost, what is the component that results in they owing and they are not able to move out of the facility after they are done giving birth?
Okay, so like the basic things I mentioned, if they do not present them during labor, it means the hospital or the facility may have to provide those things for them. And when you are there, you would have to pay. And certainly there are some components that, whether you like it or not, after giving birth, you would have to pay for. And in cases where your labor presents other conditions, like sometimes you may have some conditions during delivering, and then those aspects are not covered by the free maternal health care policy. It means you would have to offset those bills, and these women are not able to. So what some stakeholders are demanding or suggesting is that once it is established that, look, this health condition was associated with your pregnancy or even during your childbirth, then it must be catered for by the policy.
Right. So when you speak to the hospital or when you speak to the medical centers, did they give you an idea of how much we are talking about?
Yeah. They didn't mention, but sometimes it would surprise you that these are not some huge amounts we're talking about here. But hey, you look at the economic condition in some of these rural communities in the central region, and you realize even to raise 500 cities may even take someone an entire year to, do that. And so it means that people are really struggling. Then you remember the conversation we had last week about the teenage pregnancy, which is also on an alarming rate here in some parts of the central region. So when the teenage is pregnant and she is not able to cater for herself, the person responsible for the pregnancy is also not in the position to offer support, then it means that they also, have to experience this kind of situations where they are detained in the health facilities for several weeks before, they are being discharged only when some benevolent person decide to intervene.
Right. Talking about the issue of the teenage pregnancy. Okay, I just saw one of the ladies that was in the last report, and it's quite sad that she's still in the hospital. So that means she must have been detained too. Now, I just want to know, when you speak to the medical practitioners or the hospital, is there any, say, intervention when it comes to family planning? Do they teach them all this? Because we don't want situations where someone will give birth and they cannot afford to pay for their medical bills and then come back next time again pregnant. Is there, do they teach them all this?
That is a very big issue, and there are several factors that comes to play in that aspect. Like culturally, people may want to give birth to a certain number of children, and until they have that, they decide not to be on break. Then there are those who are not just ready to, to have any family planning services. And then there are some exceptional cases where people are willing to, but sometimes it happens. Like Philippa Santi, for instance, was telling us that she already has 2 children. And so she was advised by medical officers not to give birth again. And so she was considering family planning. But then also because she has that liver disease, she was advised that it would affect her even more. And so the family planning wasn't an option to consider. And then, it happened that she got pregnant again and had to sadly suffer the same situation she suffered in her earlier births.
Well, we have a very big issue on our hands. But anyway, let's bring in the Chief Executive Officer of Celsi Foundation. They moved in to defray some of the cost of these mothers or the pregnant women that they can be set free. Selassie, good morning.
Hello. Good morning.
Hello, good morning, Selassie.
Hello, good morning. Please, can you hear me?
Good morning, Selassie.
Good morning.
I trust you are doing well.
Yes, please, yourself.
Yeah, I'm doing good. When you visited some of the facilities where some of the mothers or pregnant women are stranded as a result of not being able to pay the hospital bills and all that, did you get the sense that the nation has failed when it comes to the coverage of the bills of mothers when they are going to give birth, which ideally is supposed to be catered by the National Health Insurance scheme or policy?
Oh, okay. So, what I would say about it is that although the nations have maternal health care, that is the free concerning the health insurance scheme. So I think it's covering some of their bills, but just that it's not that effective. So the nation or the country cannot do everything at all. So we need to also come in and support them in paying some of their bills, because some of the bills are not that huge, and because there are many, the government cannot cater for everything. That's the more reason why the organization took it upon themselves to come in and support these mothers. So I think the maternal health care or the health insurance scheme is not that effective, or that policy that they have is not that effective. That's more reason why the system is not working 24/7 for us. So we are doing our possible best to also support our mothers.
All right. So if you say it's not effective, what are some of the loopholes that you have seen?
Okay. So with the gap that we have seen is that they should implement. There's a policy there, but it should be effective to the extent that if they have given birth and the bills are not that huge, the health insurance scheme should be able to cover the less bills or the bills that are not that huge, so that these mothers too, the stress on them will be relieved. Because if someone is owing 100 cedis or 200 cedis, 500 cedis, and they are still at the hospital, they are not being discharged because of that bill, then it's a huge problem for them. So maybe those that are undergoing CS section will be considered, because it's not their fault. It's an emergency. So if they are going through that stress, I think that policy should cover all those things, so that our mothers will not be stressed. Because going to give birth and you go through all that pain, and at the end of the day, after giving birth, you will still be at the hospital. I think it's a huge problem. So they should consider that and help our mothers too.
All right. So what are some of the amounts that you have discovered that these women owe? Like, how much are we talking about?
Oh, okay. So let's say for those that goes under cesarean section or CS, some are owing maybe 1,000, 2,000, 500 cedis. It's not that huge, but still, because they are not able to pay the bills, they will still be detained at the hospital. And this is a major problem that we are considering, that no little amount, or they don't need a huge amount of money to be discharged from the hospital. So 500 cedis and they will be still there, 1,000 and they will still there, 2,000, they will be still at the hospital because they are not able to pay for that bill. So it's not huge, just 1,000, 2,000 and 500 cedis.
All right.
Some are even only 100 cedis and they are still at the hospital.
So when they are detained, what happens? Are they being fed by the hospital? Does the hospital take care of them, or their families have to come and feed them in the hospital? I mean, if you're going to be in the hospital, that means you're still enjoying the amenities of the hospital, the bed, the lights, the water. So what goes on?
Okay, so what goes on is that some of the nurses are able to cater for some of the mothers who are not able to pay their bills and they are being detained. And some too, because they don't have family support, they'll be still at the hospital, and they will need support from the public. That's where NGOs come in to support mothers like that, and the nurses are doing so well. Because when challenges like that come and the family are not supporting, they put it on themselves to support. I don't know if the hospital is doing their best, but what I know is that some of the nurses, the in charge and the midwives are supporting these mothers in case they are being detained by the hospital because they are not able to settle their bills. And the NGOs or people from the public or public are also supporting these mothers.
Right. And when you talk about support, family support, what do you mean? Is it like a husband and wife issue? Is it like a mother and father issue? Or the whole family has to come together, the mother, the father, the husband, everybody? What's up?
So you see that not everyone that get pregnant that is married. So some are being raped. Some too they didn't plan to get pregnant, and at the end of the day they've been able to deliver. So even tracing their family members is very difficult because they will just tell you, I don't have any support. No one wants to cater for me. They are saying that I didn't plan to get this. You see, so they don't even have family members. You trace them and you not get them. Some too, they are married, but the husband, because they have challenges, because they are not financially stable, they find it difficult to cater for the bill. So it's not just that they are married, the family are not helping them in any way. There is no money. They are having challenges. They are vulnerable. That's the main reason why they are so dead. So the nurses take it upon themselves that they will have to feed them, because feeding cry is a very problem. They don't have any amount to even buy food and eat. So they will just be at the hospital. Then the nurses have to find ways and means to cater for them.
Well, Celeste, before you go, so you visited, how many facilities did you visit, and what were some of the items you gave out? And is this the first or the last you're going to do this?
No. So we visited 5 facilities. Trauma Specialist Hospital, it's a referral hospital, and we visited 4 facilities to Goma West Health District. So what the items that we gave them baby items that they need, and we also provided them with some of the stuff that the mothers will need after delivery, and also pay some of their bills for them. And we are not just doing this for a day or just doing it for once. So it's something that we will keep doing. And after that, what are the impacts? After we have some of the mothers that they are not working. So after we've donated these items to them, we have arranged a skill training that we are going to give to them, training them on liquid soap, pastry, so that they can get something doing, because they don't have any money to cater for them bills, their bills, or cater for their children and themselves. So after giving them these items, there is something that we are supposed to do for them as well, so that they will be financially stable. So if we are able to do this skill training for them, I think they will use it. They will. So for instance, with the pastry, for instance, if they want to go into this business, they will do it and get money. And next time, if they are pregnant and they go out there to give birth, they'll be able to cater for their bills. So we are not just giving those items and leave it like that. After donating to them, paying their bills, we are going to train them as well. So every year we are going to do that, if we have the funding and the resource available.
So lastly, thank you so much for your time, and we are grateful. The Chief Executive Officer of Celsi Foundation. Well, they did a very good job by visiting some of the facilities to clear the debts of some of the mothers and also donating items. You can also do that as well, because we are all building a nation. But Akwesi Ado is still on. Akwesi, Celeste made mention of a number of things that are of concern in the region and also at the facilities. From where you sit as a reporter, are you visiting a lot more of these facilities for us to know what really the issues are? Then we can speak about them here and also find the needed solution to it.
Sure thing. So we are mandated to highlight some of these challenges, and that's what we would keep doing. Philip and Chris. So the question is, everyone has reproductive rights that must be protected and respected. And so do we say that if you're poor, it means you cannot give birth, or what? Then what's the dignity in this as a human? So I think we all need to have a working policy that would help address some of these challenges. Like Selassie mentioned, these are not some huge amounts ranging between hundreds days and then, I mean, are they at most 2,000 Ghana cedis? This is something that the free maternal health care policy should be looking at, just so women can give birth in a more dignified manner than what we are presently witnessing.
Okay, Akwesi, thank you so much for your time. We are grateful, and keep bringing us stories like this so that we can find solutions for them. But Chris, I think that I always say this: in life, you plan,
Right.
and if you fail to plan, that means you are planning to fail.
Exactly.
If there is a family and you want to have children now, children are very expensive if you do not know, because you are buying Pampers, you are paying huge amount of money for the child. When the child goes to school, you are a lot of things, so you would have to plan. If there is a policy that where you've got into as a child or a girl, you would have to get school to hold you on for some time before you give birth. I think it's right, so that you don't give birth to a lot of children,
Yeah.
and you cannot financially cater for them.
You see, and I also believe that this whole free maternal policy thing goes hand in hand with, sex education. If sex education is had in the beginning, these mothers will really protect themselves and know how to act. Do you understand? Because I feel like a lot of people are just, yes, there is free maternal policy,
Yeah.
but you're trying to get pregnant every minute, every hour. I'm not blaming them. It's just the lack of knowledge. It's just a bit of ignorance. And like,
That means we have a lot of work to do.
yes, and like Selassie said, some of them are also in vulnerable states because they were taken advantage of, because they were probably raped and they found themselves there. So I think it's a whole 360 work that has to be done with the law, with maternal health, with education. Everything goes hand in hand. You cannot do one and leave one.
Wow.
You cannot say, okay, I have worked on sex education, I have worked on this, and leave maternal health, and say, okay, I have worked on this, and then leave punishments to those who abuse people. No, it goes hand in hand. It all has a ripple effect, and I think everything has to be worked on. But a very big thank you to people like the Celsi Foundation. We also have people in Accra doing the same thing. We have the Post-Pregnancy Bougie Express by Vanessa Jan. She also does the same thing, because you think it's not happening in Accra, it also happens in Accra.
Well,
you understand?
Let's see how the education is going to go down, and how we are going to help for our girl child not to really get themselves into that situation, because it's a very difficult one to deal with.